afternoon, everyone. Thank you very, very much for inviting DSS Durham, myself. And this is Cynthia Kaysen. She is our Assistant Director over our newly formed division of Medicaid. To help with the expansion, we actually made a new division at DSS Durham. We separated Medicaid from Family Economic Independence, which also has our child care, Work First, and food and nutrition program. So we are truly dedicated to making this a success in Durham County for our residents and our community. This is a great, I just recently moved to North Carolina from Florida, and I can say that Florida did not go into expanded Medicaid. So I'm very, very proud to be in a state that did, because in a few weeks, thousands of people are going to be insured that did not have that opportunity before. So I'm very grateful to be here today to present to you all. And we'll go ahead and get started, and then we will have time for questions. So in March of 2023, this is when the law was signed into effect in North Carolina to expand Medicaid. As I said, not every state has taken this opportunity. North Carolina has done so. Originally, it was supposed to start on October 1st, but due to budget issues at the state level, it got pushed back to December 1st. So we will be going live here in Durham and across the state December 1st, 2023. And I think that the one thing that we just want to stress here is, again, North Carolina is one of the 41 states that expanded. And what it looks like for that is that all adults ages 19 through 64 with incomes up to 138% federal poverty level will be eligible for Medicaid. So to break it down a little bit, that's an annual income of up to $20,000 for a single individual, or $34,000 for a family of 3. So as you can imagine, not having this level of insurance before and having that level of income would have been extremely challenging for families. Medicaid health insurance covers regular preventative care, treatment for chronic health conditions, and maternal care. It also includes physician and hospital services, vital prescription drugs, behavioral health, and more. And it provides high quality and affordable healthcare options to people who need it, that are in a great financial risk or have a health emergency. It allows people to be more productive in their jobs, and allows families to be together and spend more time together, quality time. When someone in your family is not well, that impacts the entire family. The only thing changing is who is eligible. Everything else stays the same. And I'm going to turn it over to Cynthia now, because I want her to explain a little bit about that, because we get caught up in the language of Medicaid versus Medicaid expansion. And so I'm going to have Cynthia kind of go over what that really looks like.
Yes, good afternoon, everyone. In reference to the Medicaid expansion, what I would call the traditional Medicaid as we know it now, Medicaid expansion is not a Medicaid program separate from the Medicaid. It is an additional program that we will be evaluating individuals for when they come into the agency. When someone comes in, we would take a Medicaid application. Staff will take the application, determine eligibility, and if an individual is not eligible for the Medicaid as we know it now, they will be evaluated for Medicaid expansion. So I want people to understand that it's another Medicaid program added to the many Medicaid programs that we currently have, that we will evaluate someone to see if they're eligible for it.
Thank you. And Cynthia and I both request that as many people apply using ePass, which is now online, as possible. And there's a reason for that. We were very fortunate. Our Board of County Commissioners recently approved us to get 35 new positions to help with this expansion. And the next few slides will explain why we needed that number of positions and what we're looking at in Durham. But we are still pretty at capacity, and even in our building and with parking downtown. So it is vital that as many people apply online as possible. They will get their application, I think, will be run through smoother, and it's not going to involve them coming downtown. And of course, that's still an option. Everyone can apply online, by paper still, in person, or by phone. But we are encouraging the e-pass, and again, that's epass.nc.gov. And that will be both in English and Spanish. So if you are Spanish speaking, you have the opportunity of all of these, coming in person, by phone, paper application, or the e-pass. So the impact for Durham, and why we needed those positions, is that the impact is going to be, we're expected to see about 21,622 new enrollees in Durham alone. So it's about 600,000 across the state. But Durham, and that's going to be added to our current estimate of about 74,500 beneficiaries currently. And then to take that into another perspective, these are the expected enrollees. So these are the ones that will actually qualify for Medicaid and be enrolled. But we have no idea, neither does the state, how many people will actually apply. And not all of those, of course, will be eligible, but we cannot tell any individual they can't apply. So we have to take all applications, and that again takes staff time and capacity. So that's going to be something that we're going to have to be looking at. And just a little bit about Durham, our county's Medicaid population is about 23.7%. So when you look at some of our other counties that are similar to us in makeup, Mecklenburg is just a little bit over 25. So that's still, considering Charlotte, that's huge for Durham to be at 23.7. Wake is at 17.5, and then Forsyth's at 28.7%. So I just included this to give you a little bit of an idea of, where we are in relation to other counties. Now, the federally facilitated marketplace, this is also going to be part of what we say Medicaid expansion. So what this is going to look like, and the state is still in communication with the federal government. They have to come to an agreement on this, but it would make it so that we're a determination state for the Affordable Care Act, for the federally facilitated marketplace. So currently we are not doing that. When this takes effect, and I just had a meeting with the state representatives last week, it looks like it'll be taking into effect in January. So that will again open up even more opportunities in North Carolina. And Cynthia, I didn't know if you had anything else to add about the federal marketplace, or?
No, not at this time. No.
Okay. Mm-mm. And again, this is not in effect yet.
Right.
We are looking at as January. That was the state's last, but again, it's with the holidays and everything and how their meetings go with the federal government, it could be February or another later. So as I said, there's no way to predict the number of new applications we're going to receive. We can't refuse anyone. We believe that we're going to see a huge influx in applications, especially probably in the beginning. This is going to be new to people, and I think one of the things, and that's why I asked Cynthia to expand a little bit about what this looks like, is that I think some people are getting the message that this is a new Medicaid, meaning the requirements are going to be different, and that's not exactly accurate. So they would still have to qualify and apply just like with any other our Medicaid programs. So I do believe we're going to see a great deal of applications. So that 21,000 that you saw, again, are new enrollees, not the actual number of applicants that we will be getting. So for those on here that are medical providers, what we are asking is, and what we wanted to share with you, we're going to be pressing for staff to expedite and process applications and recertifications as soon as possible. This will be due to ensure that their reimbursements for services are timely. We've already had conversations with some of our medical providers who are going to increase their efforts and having patients apply for Medicaid. Again, e-pass as much as possible. It may include, it's going to probably include increased calls to your offices about the new details of the program. Some have already said that they have started to receive this. And I'm sorry, the law has passed. That's inaccurate. And then you and others may get calls about this issue as well. So anyone in the community that serves the community is probably going to get questions about this, especially if you're in and about the social work or nutrition or medical field. So we just wanted you to know that we're here to support and answer those questions. We have a call center. The state will also be reaching out to families. They've already started that, I believe, as of yesterday. They started to call different families to let them know about December 1st. So you will also see an impact in some of your agencies just with the amount of calls, and then possibly, asking how you can apply.
Yes, and if I just interject that we are seeing an increase in calls. Individuals are calling and inquiring about the Medicaid expansion, which is a great thing. So our community and our county is aware of it, and we're giving them the information at December 1 and options in applying. So I think that a lot of our individuals that we receive will be working individuals that may not be able to get down here within our hours of operation. So we're giving them options of ways that they can apply, but we are seeing an increase in calls.
And I do want to say that we have put this messaging out through Spanish-speaking radio, as well as Radio 1 in Durham. And we will be flooding social media. The state has actually created some really great talking points and I don't want to call them memes, but social media type posts. And we're happy to share that with you as well. If you have social media that you would like to share that with, we can definitely, I can send that in and you can share that. We're happy to do that. It's in Spanish and English. But again, Durham DSS is also doing our own push out on Spanish and English speaking radio and news. And this is just what all of the counties are really asking for is just your support. It's going to be a heavy lift and for staff that have already been working, very intensely with what we currently have with Medicaid. And so this is going to be a huge lift. So what we can say is that 35 new positions we already have identified staff for several of those positions. We had a job fair on last October 28th. Thank you. My Saturdays are going together. We opened up our building on Saturday and we interviewed 101 applicants in 5 hours. So I was extremely impressed with my staff that showed up that day. We actually had more staff in other divisions working that day than Medicaid staff. So that was huge. That really meant that Durham DSS as a whole is behind Medicaid expansion. We had another job fair on August 4th and we interviewed 130 staff, knowing that we were leading up to this, and we have successfully onboarded all of them. So we are definitely going to be working with our staff to make sure that we answer emails quickly and timely. We answer phone calls. We get back to you all in the community and to your clients that you serve. We just ask that, as you all know, that there is probably going to be a little bit of lag time here and there as we work out some of the kinks with the state system as well. The state has a role in this as well with processing, and so there might be some times where it gets a little bit delayed, but it should not be very delayed. But we just ask for everyone's support and understanding from citizens of Durham and also the community. Did you have anything to add, Cynthia, to that?
No, I think on the next slide, I have some. Okay, yeah, and just to add to what Maggie has shared in reference to providing excellent customer service, that is our number1 goal. At the same time, while doing that, we recognize that we're going to have an influx of applications, Medicaid applications, and the quantity is going to increase. And we know that ahead of time, and we are preparing for that. At the same time, we want to make sure that we are doing our due diligence and ensuring that the quality, that we are adhering to the eligibility requirements that's required. At the same time, providing services as quickly as possible. Our application processing time is 45 days, up to 45 days. Hopefully it will not take 45 days, but I'm sure that we will see an increase in the application processing time frame with the number of applications that we anticipate that we would get. But again, we will work as quickly as possible, doing good work, and also at trying to adhere to our expectation, our timeline.
And I will leave you with the phrase that we now say at Durham DSS every day, and it's became popular thanks to Ms. Kaysen. It's a great day in Medicaid. And that is, we wake up in the morning saying that, and we go to bed saying it.
Yeah.
And so we're very excited, and Durham is extremely fortunate. I will say this: Cynthia came out of retirement to help us with this. She is a huge advocate of Medicaid. And we could not be more happy or proud that she has joined our team to help us with this transition. As a new director, I could not be doing this without her. And so I want to publicly say that Durham is being served very well by one of the best. So
Thank you.
You're welcome. And that is all we have. I know I can see that I think we have some questions in chat.